Recording in progress.
Hi guys.
Hey,
Am
Dr.
I
Chang,
supposed
you
to
ready? I'm gonna have
begin
Donna
the
comes up,
seminar
okay?
now?
Not yet. Let me have Donna
I
come up
guess
do the
Donna
intro
has
for you.
something to say first.
Yep. Give me the minute. Let me go set this up.
Hello.
I'm gonna have Donna come up right now.
Nice to see you too.
Hold up.
Okay. Shall we begin?
Hold up. Donna coming up right now.
Hello and welcome to today's webinar with eLotus. We have been hosting educational courses at eLotus for over 2 decades and are proud to be your trusted source for premium CU content with over 250 speakers, 900 courses, and 3,500 hours of continuing education. My name is Donna Chow and I'll be hosting and moderating today's class. We're so happy you guys can join us today. Today's webinar is Hyperthyroidism and Hypothyroidism, Dr. Jimmy Chang's Herbal Master Sheet, presented by Dr. Jimmy Chang himself. He is one of our best speakers out of 250 instructors over the last 20 years. Class will be held from 2 to 4 p.m. Pacific time. Before we begin, let's go over some important details about the chat room, questions for Dr. Chang, and your CU quiz. For the chat room, please set your chat preference to everyone so whenever you type and submit your comment, everyone can see what you're typing and be part of the conversation. For questions for Dr. Chang, please submit them to the Q&A box. And for your quiz will be emailed to you tomorrow and you'll get an email notification when it's ready. Our speaker today is Dr. Jimmy Chang, a doctor of Oriental medicine trained in Taiwan and a licensed acupuncturist here in California. He has over 40 years of concentrated clinical experience treating over 500,000 patients and applying his expertise in pulse diagnosis and herbal prescription. In today's class, you will learn the tried and true formulas from Dr. Jimmy Chang, the master of herbology, as he explores the art and science of his unique herbal combinations. You'll also learn the pulse indications for these specific conditions and how to prescribe a unique herbal formula for your patient. Dr. Chang previously taught a number of courses for us, which are now available as distant learning CU videos. If you want to be able to diagnose a patient's pulse, identify Western medical diagnoses, and create clinically effective herbal formulas, Dr. Chang is the person to learn from. He'll help you improve your pulse diagnosis and herbal skills. To learn his pulse system, we recommend the Gold Pass membership. Your yearly membership gives you unlimited access to his foundational pulse courses and herbs prior to 2020. And with the Gold Pass, you can also try the herbs he mentions because our sponsor, Evergreen Herbs, will provide you with an herb voucher worth the price of the Gold Pass membership. There really is no better value if you're serious about learning herbs and becoming proficient in them. To learn more, I'll post more information in the chat room. For now, let's get started with today's class with a quick overview of how Dr. Chang uses herbs, because we do have some new students in each class and we don't want anyone to get lost. If you're a longtime student of Dr. Chang, please bear with me as I quickly review the information, or feel free to step away for 5 minutes. Dr. Chang's herbal style differs from the traditional methods taught in school. He only uses extract powders exclusively with evergreen herbs. Evergreen Herbs carries approximately 300 single herbs and 100 formulas. Dr. Chang's pharmacy carries about 150 single herbs and formulas combined. If you're curious about his pharmacy, a link to a YouTube video is included in your lecture notes. Formula evolution. Dr. Chang creates his own formulation that he frequently uses in his practice. He usually names a formula after what it's used for. These are his more recent formulations, which may change as he sees more patients and modifies them accordingly. Whenever he updates the formula, he'll add a 2.0 after it, so you know that there's a version 1 and a version 2. Next, what is Fang Jia Fang? Fang Jia Fang is the combination of various formulas to produce a better effect. Did you know that herbal formula granules are made in two ways? That first method involves combining all the ingredients and simultaneously decocting and extracting them, then turning that concoction into granules. The second way is a combination of the second way is to combine separate ingredients that are already granules and adding them together to make the formula. Evergreen does it the first way. In Fang Jia Fang, the concept is to combine formulas rather than single herbs. If you're unclear about the Fang Jia Fang concept, Dr. John Chen has created a YouTube video that explains it in a different way. Dr. Chang prescribes herbs in a 100-gram bottle or 150 grams if the patient is not local or if it's a chronic condition. The bigger bottle allows the patient to receive a discount on the herbs. For a 100-gram bottle, Dr. Chang prescribes 3 spoons 2 to 3 times a day. How to read Dr. Chang's prescription. If Dr. Chang lists a few herbs and then a number at the end, that means all the herbs before that number is at that percentage. For example, Dr. Chang's Sleep Combo 2.0 is 酸枣仁汤 at 40, 益焦糖, 合欢皮, and 止痛饮 at 20. Can someone tell me how many grams is 止痛饮? Go ahead and type it into the chat room. So Sleep Combo 2.0 is 100 grams total with 40 grams 酸枣仁汤 and 20 grams each of 益焦糖, 合欢皮, and 止痛饮. So the answer was 20 grams. Great work, everyone. Next, do you have to mix herbs by yourself? You certainly can. Some herbal formulas such as circulation sanjiao, astringent, and herbal ABX have already been pre-mixed as collection formulas, which is Evergreen's proprietary line. Many of the new formulas are not pre-mixed because Dr. Chang is still working on them and customizing them. So please feel free to mix them on your own or use Dr. Chang's formulas as a base to create your own formula. And that's it for the short intro, everyone. I hope it was very informative for you. Let's now welcome Dr. Chang, who will go ahead and take over from here.
Okay, guys, it's me again. Today I'm gonna talk about some kind of thyroidism, hyperthyroidism. So can you see the okay, I'm sure you can see the picture now, huh?
Yep.
Today
nice.
will be hyperthyroidism and hypothyroidism. It's very effective and is very, very interesting. And then whatever we previously have talked about over the internet, everything is based on my 45 years clinical experience. Today, I'll be talking about the hypo Hashimoto thyroiditis and simple goiter, how to treat them and how to make the proper diagnosis. The interesting part of this thyroid stuff is it's amazing. Let me tell you what. Okay. Everybody can hear me correctly, right? The microphone is working? No problem, huh? Okay. The problem of this thyroidism, the diagnosis with this kind of a problem is that all those symptoms are non-specific. All the post-diagnosis are maybe non-specific too. So it's very confusing. But once you get familiar with all those strange symptoms and you narrow down to the thyroid, you blame it, all the problem to the thyroid, then you'll be able to treat the patient's problem more effectively, more than the simple the differential diagnosis according just to the symptoms. The old ancient book, your textbook, say the 辩证论治, 辩 means make a differential diagnosis according to the symptoms, which is totally useless and bad. At least you guys here listening to my all the seminars, you all know my post-diagnosis system very well. But today I'm going to tell you something it's a little bit more out of the box. You're going to like it. Okay. For example, the hyper stuff, you have a lot of symptoms, weight loss, rapid heartbeat. Now, people might get Rapid heartbeat, it might be mistaken as a heart problem. Oh, the heart problem, go see a heart specialist, and the specialist give a EKG and everything and put you on a pacemaker or something like that, huh? Increased sensitivity to heat. The fire we will experience. We might use some US one, something clear the heat with something that actually it's not just simple heat and sweating. Oh, some lady will come to you, say, hey, doctor, I have hot flushes. I sweat all day long. I mean, especially at night. Hey, doctor, I have a tremor with my hands. Somebody might tell you, I have irritability and nervousness. I'm just nervous all the time. And the heartbeat is fast. And somebody may tell you, oh, doctor, I'm so weak. My muscles are so weak. I cannot lift a heavy weight, and whenever I do something, I feel tired all the time. And somebody might tell you frequent bowel movement. I go to bathroom all the time. Hey, doctor, help me. Naturally, you will think through the point to the digestion system. You may focus your pulse on the guan area, on the left hand guan or on the right hand guan, according to my second system. Lady might come up to you, says, I change in menstrual patterns. My period comes sometimes heavy, sometimes very limited, very small, like 3 days is gone. Sometimes it comes in 7 to 10 days. Then naturally you will focus on her left-hand side, left chi, because that's the genital area. And somebody may tell you, oh, this is very popular. Or you can make your own diagnosis without having the patient to tell you what's going on. But after you made up your mind, hey, you have a problem. You're so nervous. You have anxiety. You have stress. You have depression. You cannot sleep well. Okay, naturally you will go to my feng, my sleeping anxiety combo stuff for this her problem. Maybe suffering somebody from high blood pressure. Of course, we might want to use my blood pressure medicine, blood pressure combos, things like that. Oh, somebody say, I always eat too much. Please, doctor, please help me to suppress my appetite. I'm gaining weight. I'm not losing weight sometimes like that. You see, all those problems, if you go to the, like my experience in Taiwan, if you go to the hospital with all those complaints and discomfort, you might be lead to a different department. Frequent bowel movement, you could have digestion to the stomach problem, muscle weakness, you might be transferred to the nerves doctor, and this you might be transferred to a psychiatrist. Then this you got to a doctor with the internal medicine. Then you will be transferred to a doctor with the psychiatrist or something. So all those things actually you can narrow down to the thyroid. Thyroid has two. The pulse can be, okay, for this kind of problem, the pulse should be in deficiency. Thin, floating, fast, and weak. The pulse can be this, but it's very superficial. When you press down, there is no rebound underneath. And the majorly is the fast. So we kind of like in deficiency because your body is exhausted because your thyroid is moving too fast. Like the engine is moving too fast without going anywhere. So after today's, you might have the idea that all those problems can be originated from here. This is where the thyroid is. And also you might see some red spots here. This is the, let me try this one. This area may be the ovary or testicle of a man, but if you see some redness there or darkness there, that can be the thyroid. Almost seems like this. So from today on, you have widened your perspectives and you can learn more from being told all those discomfort. And you'll be able to make your proper diagnosis and make the proper decision how to treat this patient. And what I'm trying to tell you is that you might ignore all those different kind of complaints and just simply narrow down to the thyroid, and the treatment will be much more successful and wide spectrum. Isn't that great? Okay. So, so like, I mean, traditional Chinese medicine, they treat symptoms, syndrome, or whatever. Symptoms are totally unreliable. You must focus on the reason, the root of the problems. Now, today you learn most of the different kind of different area, all the discomfort coming from a thyroid. Isn't that great? We made the treatment easier. You don't have to treat the blood pressure and treat his sleeping problem, treat his bowel movement, treat his weakness by adding something like a 十全大补 for that. You don't have to do the my anxiety combo for this tremor, and you don't have to do the sweating or the female part with the hormonal treatment. You don't have to do the hard herbs for the rapid heartbeat, tachycardia. No, you don't. You focus on the thyroid. That's the point of today's class. Okay, this is the stomach, actually it's intestine. And this is abdomen. Abdomen, the swelling tissues is just in this picture, but not related, might not be related to the thyroid. And this is the hip. See the darkness there? He might have some old injury from the pain. Huh? Okay. Any questions so far? We narrow down all those different symptoms just to one thing. I mean, the thyroid. Huh? Okay. Okay, but for pulse diagnosis, unless it's very extreme, that's this lady. I've met several ladies that are so nervous. They even when they talk, they cannot stop talking, and a lot of shaking in the voice because she always forgot to breathe, so cannot catch her the breath, and just keep on talking all the time. But that's sweating and being thin and that symptoms too much. It's too easy to identify. But most of people, even sometimes their blood test shows normal. Their thyroid has nothing abnormal. But we can still narrow it down and blame it to the thyroid. But how do we differentiate the condition? I use my pulse diagnosis, something like this. This is the normal pulse. 寸关尺 is here, okay? But this is the tendon and this is the 少阴. Usually, I mean, before, I use the 少阴. 少阴 is a little bit shorter than the normal 寸关尺, but still have 寸关尺. This 少阴 pulse might not be there all the time. You can check your own 少阴 or your patient's 少阴. Sometimes they're just not visible, not you don't feel any rebound, but sometimes it's very hard. For the right hand side, well, it doesn't matter. Sometimes it doesn't matter left or right. Only for the sex hormone. The sex hormone on the right hand side is the male hormone. Left hand side is the female hormone, the sex hormone. So if the lady presents a very strong 少阴 on the right hand side, I always tell her that you're so bossy, and they all laugh and nobody ever deny it. On the left-hand side is the female hormone. So if you're treating a guy, a guy too, yeah, a lady with infertility, you should focus on the Shaoyin, both hands, see if they do have enough hormone or not. If both hand, if both hand, the Shaoyin is very weak and no rebound, you can, if the lady only 35 years or 40 years, you can directly tell her, hey, you're aging too fast. Your body is older than your age. Oh, anyway, on the right hand side of the human, on the pulse is, it doesn't matter if for thyroid, it doesn't matter left or right. It only matters is the strength, the strong or weak. Strong means hyper, weak is hypo. So simple. Isn't that interesting? So easy. All you have to do is follow the sign and do the treatment plan accordingly. Try, you know how to take the pulse, right? This is almost heart 7, 神门穴, somewhere there. Okay. A patient would not necessarily have all those symptoms. Of course not. I'm seeing a very slow heart rate with blood work showing subclinical hyper. Yes. With high normal hormones and below. Yes. That's a good question. And I just seeing at least 3 ladies with this conflict. I just directly tell the patient, hey, your body is a conflict. It's a paradox. Why? Because her symptoms, her ear point shows all red and stuff. And the thyroid part is dead fish, not jumping, no rebound. So I tell her, your body is not functioning too well. Your engine is running, but your temperature is high. Your activities are too strong and unstoppable. So that's a very conflict condition. Hot and cold, fast and slow, strong and weak appears at the same time. So that's why I gave her Wu Mei Wan, Xiao Cai Hu Tang to balance it up. That's correct. Yeah. So sometimes the pulse and the ear signs don't match. But I'm going to tell you later. Oh, okay. Just make sure you take the Shaoyin pulse all the time. After taking the normal pulse, then you go to the Shaoyin, see and record it. Put on your evaluation sheet. Okay. Interesting, isn't it? Not all the human body can be that unique. Can be that simple. All heat from top to bottom, all heat, all cold. No such thing. Capture. Which side? For thyroid, doesn't matter which side. Okay, next one. Okay, for pulse diagnosis, Shaoyin, how do we treat the hyperthyroidism? We do this. Herbal formula hyperbreaker. It's interesting. It's very easy because see, this area is not very clear, but there is clear. That's hyper, especially the heartbeat rate. And see this guy, this head is red. This has some scar in the stomach, and all the redness in the stomach. And see all the redness. The knee joints and the colon is very dirty. And see the neck and shoulder are dark. And this is the head. It's dark too. So this patient, so this patient is full of conflicts and paradox. So when you treat him or her, you should be very careful. See, the head is red and the neck is dark. So we might use cold medicine to clean the heat, or use blood mover to do the stagnation. And see, this is supposed to be the gallbladder or something. And this is stomach, is one red and one dark. So this is her her body or his body is already a paradox. But anyway, for the hyper stuff, when you make up your mind, after you made up your mind, hey, this guy is hyper, then I use 玄参 and 夏枯草. I use this, it's a combo. Like a code breaker or something, heart breaker. 山林而足 is kind of a code breaker to break up all the blockages. 虎杖 is for drop things down. 虎杖 is a very wide range herb, broad spectrum, because it can clear the heat to drop it down. It can clear the heat in the respiratory system, like for cough, for the throat problem, which might be also the result of the thyroid. I'll let you know later. And Hu Zhang is good for moving the blood. It's very funny. He's cold, but he still moves the blood. Astringent complex is for any swelling tissues. I'm sure everybody knows this. If you don't, check with Tina. Hello. Okay. So this combination takes care of all the aspects. I use this 玄参. 玄参 supposed to be a dark and sour and bitter medicine, cold and sour, so it will shrink all the swelling tissues. And 夏枯草 is the same. 夏枯草 is good for thyroid, and this guy must have some kind of headaches. 山林而足 just works like a bulldozer to clear all the blockage on the road. 虎杖 I explained earlier, is for lowering the heat and for dropping all the phlegm and in the chest, not only chest, but in the throat. So the throat problem can be the result of, from the thyroid. Astringent complex is good for any kind of a swelling tissues or forceful swelling process. Try to bear it in your mind. So you can put them together. That's what I do. Put them together. Okay. Any questions? No more. Oh, and the next kind, next group is the hypo. Oh. Hypo. Hypo means low. See the darkness here? That's very clear. But this is a strong case. Maybe his blood test already showed the problem. That's the thyroid, But sometimes the blood test can be still in the normal range, but they still have all the symptoms: fatigue, weak, slow, face frozen, and weight gain, edema. So when you see somebody is a little bit chubby, some lady with a little dark spot on the skin of the face, and there's no expressions, looks so dull, then you have to think about this condition, hypo. Easily to feel cold, increased sleepiness, very, very tired, sleep all the time. In this case, can we give him 十全大补? Actually, we cannot. Dry skin, maybe pale, but I would go for darkness. Most of this problem patient will have very dark skin. Constipated, poor appetite, digestion, it's no good. And you might want to tell, after you made all your proper diagnosis of the whole system, if the patient's major complaint is the digestion, you still should focus on the thyroid, not just the stomach. Okay. And how do we do that? I'll let you know. Muscle weakness, cold pain. Cold is the key word. Why cold? The patient is weak? Not necessarily. It's just because the circulation is terrible. So hers or his blood cannot transfer the energy to the extremities. And with all the water retention, little chappy body type, all the water retention prevent all the circulation to the extremities, to the small capillary vessels. So they're cold. And this is the most popular. Memory of concentration. Everybody has it. Period, heavy or light. Sometimes it's heavy, sometimes it's gone. But they also have some kind of a infertility problem. If you're treating a lady like 30 years old, something want to have baby, you should put this one into consideration. Okay, so you see the darkness here like a charcoal, so dark. Actually, you see all the skin here looks so pale. No blood. No blood means no circulation. And some abdominal lump or hernia. I was seeing a big, strong guy, a Mexican guy. He had darkness here. I said, something on your testicle. He said, yeah, I have the pain there for 5 years. I've seen so many doctors, nobody knows why. And just there. Very easy. We can treat it easily, right? So anyway, I'm trying to say is this, people might, one single person might have all those different type of complaints, but we cannot do them. We cannot treat this guy or this lady separately. You cannot say, hey, today I'll trick your appetite. Tomorrow I will fix your weakness. And maybe the other day I'll take care of your edema, or take care of your energy or something. No, we can treat all those discomfort from one thing, from the hypothyroidism. So today I'm telling you this. We have to narrow down. Sometimes people's major complaint can be very complex and complicated. They have so many things to complain. They just keep on talking. Hey, doctor, I cannot sleep. Doctor, I don't want to eat. My muscle is so painful and weak. I cannot remember things. My period is wrong. That really is some kind of a confusing and frustrating complaints to you. If you don't know today's my major concern here, you might try to solve the patient's problem today for the sleeping problem, tomorrow for the digestion. Then you're wasting your own time, you're wasting your own ability, and wasting patients' time and wasting patients' money. So actually, we can treat them all at once. It's no big deal. Okay, and for this point, you see a darkness there? Did you see that? A darkness there? If for a lady, that's something in the breast. If they say this one is dark, if on the other ear, this place, there's a red spot in there. One dark, one's red. That could be the breast cancer. Be careful, huh? Would you consider Hashimoto's? No. Of course, we'll be talking about Hashimoto right away. Okay. So the cause of this problem, this is page 11. The pause in this area will be dead fish, not jumping, no rebound here, huh? So what about the pause? It's dead fish. It doesn't jump. That's a very good word to describe it, dead fish. So you can directly, so after today's explanation, so when you feel a dead fish pulse on the, actually it's no pulse at all, on the heart 7 area, you can directly, you can keep on saying for 5 minutes, you have this, you have that, you have that, from top to head, from physical condition to his mental condition. how can the patient not be convinced by your ability? They will come back with a lot of more other friends. You don't have to do any advertising on the newspaper or something. They'll come back. So how do we treat this stuff? This is hypo, okay? See, actually, this is the lumbar. So all dark in the back area and in the neck and shoulder area. It's all dark. 16味流气饮 and 血府足鱼汤. This just for clearing the blood. After and the 16味流气饮 goes right into there. Actually, it should be another one. Sun. Wei. Chen. Something like that. Sun. I always combine this 16味流气饮 and 散肿溃坚汤. San means disperse, zong means swelling tissues, koi means destroy, jian means very hard objects. So this is like a bulldozer to clean all the blockage. Like there's a rock in the middle of the highway. We have to destroy that, don't we? And 16味流气饮 is for the qi, means qi. So this, oh, no. So this 16味流气饮 is for circulating all the dead stagnation. So put them all together, we can do by, we're not trying to tonify this kind of condition. The point, this combination here, we're not trying to tonify the body, because even though the patient is complaining about being tired, fatigue, and no sleep, no appetite, or kind of swelling foot, swelling leg, and the difficult to move, and very bad mood, and tired all the time. We do not try to tonify it by giving any 十全大补 or the 黄芪剑中. No, we don't do that. Most of the time, I just clear the heat, clear the stagnation, and the energy will resume by itself. Yeah, 30% equal. Maybe. Yeah, equal. Put them all together. But this is only for the hypo, not for hyper. Okay. Interesting, isn't it? Especially the most interesting part is that most of the time when the patient, I believe, actually 90%, or you may say 100% of patients will complain about, I'm so tired all the time. Even the big, choppy, heavy workers, something. Nobody ever told me that I'm not tired. I'm just tired all the time. No matter what the big, small guys or something. But most of the time, I do not directly give them 十全大补 or something. As only if they have cancer, they are severe anemic because of losing blood from ulcer, or from ladies from the heavy period, or just came out of the chemo, out of the hospital or something. Otherwise, most of the time I do the treatment by clearing the dead fish here. Then their energy will resume. Otherwise, no matter how hard you try to tonify the body, it never works. Okay? Any questions? So this dead fish pulse is on the, and it's very possible also on the normal 寸关尺, the pulse that just don't jump. So there's amplitude. Okay, somebody say 50, 50, 30. No, it's not. That doesn't add up to 100. Supposed to be. Okay. Okay, make. Okay. By that order, you have to add up to 100 gram or 150. So by that order, 16味刘气饮 35, 血府足鱼汤 30, and 善种灰煎汤 35. This is 100, okay? Yes, hyper, I clear heat, and hypo, remove blockages. But sometimes the same condition, the totally opposite condition can happen at the same time. Huh? So with hyper, you clear here. What's the difference in the ear that you see? I told you already. Okay. Okay, okay. So next, let's talk about the goiter. The main symptom of goiter is swelling at the front of the neck, something like that. You don't need any pulse diagnosis or something. You can directly tell. Let me wash it out. And the goiter may look and feel either smooth or lump. The swelling may sometimes just be on the side of your neck, somewhere there. The Western doctor said iodine deficiency is the condition, but iodine is fine, but my treatment will be a little bit different. I just use the destroyer. I can use sandin. Do I have a combination? Well, directly treating this, I'll be using the hypo and the hyper together. The combination I mentioned earlier, 16味刘气饮 and the 善种灰煎汤 is a group. 夏枯草玄参 is a group. 山苓儿乳 is a group. Put them all together to deal with the big lump here. It might take several weeks, even months, to make it smaller. So the combination will be 善种灰煎汤 16味刘气饮 夏枯草玄参 and 山苓儿乳. So put them all together, we deal a big, like a big fortress in the front line. We need a heavy artillery to destroy that, right? So in this case, unless this lady is extremely weak, otherwise you just simply just let go with the heavy artillery force to destroy that. Huh? If you want to put more iodine in your diet, if it's okay, I'm fine with it. But iodine doesn't treat this one fast enough. And see this hypo condition, the blood stagnation. This is the hip. This lady has, see the color here, red and dark. There's gotta be some pain there in the back. So in this case, if you treat his back pain, you want to use some heat clearing medicine like astringent or 虎让 pu yin, or with some this for inflammation, for pain, 身痛如晕。 For injury, we should use 身痛足浴汤 and正骨止筋丹. Let me ask you. So how come this how come the lady will have a stagnation on the back? Not necessarily from old injury, but for the in the birth they give some anesthetic into the lumbar for the pain, and after the birth, the dead blood just left there forever. If you don't treat it, it will hurt you forever. So you combine all the formula hyper together for goiter? Yes, equal. So also this is the blood stagnation. See, there's no doubt, some lump and big lump there and here. Actually, all those things might not have something to do with the thyroid, but see this area? Still thyroid. So you still can use my hypo combination to deal with the thyroid, and also those hypo combination would deal with the stagnation too. All the see this one and see this one, and maybe some hemorrhoid here, and the colon, especially this neck and head, and this is the head. And something here that looks funny. This must be the hypo too. I don't know if it's a lady or man, doesn't matter. This is the hypo stagnation. You just use my combination would definitely help you to treat better. What's the question? Right, all those formulas I just told you. I'm not too good with the pinyin, but anyway, yeah. This 16味流气饮 and the previously we talked about 三种溃坚汤 and this 三人儿足 and 玄参 and 夏枯草. Okay, there's another paradox here. The size of location of goiter may block the airway and voice box. Signs, symptoms may include all this. Of course, if we can visually see the patient with a swollen neck, then the answer is already there. But sometimes they're wearing a high neck, or they're wearing something to cover the neck. You cannot see it. So maybe the patient is telling you, hey, doctor, I have a problem with this swallow things here. I have a difficulty breathing with exertion. The pulse may be gu. And doctor, I have a cough. I'm sure you can make the diagnosis without having to ask. You can know that patient with the upper respiratory, I mean the bronchitis or something. The voice hoarse and snoring. If the patient just told you, hey, doctor, I'm coughing and have a snoring at night and my voice is terribly changed, you will directly be focusing on the upper respiratory system. I better use this one. If you put this symptoms together, you will see this must be the upper the respiratory system, and the sound problem with the phlegm, with the catch. Maybe the patient just caught cold, snoring, maybe the stuffy nose or something. You will naturally think about giving this patient some anti-inflammatory for the upper respiratory system, for the phlegm, for the cough. Yeah, maybe it will work. But sometimes if it doesn't work, then you switch to this one. Maybe something there, something hidden in there, not so visible. You can touch the patient's throat and see if you see something swollen there. And like I said, this run 20, then 22 point. If this place is freezing cold, then it's bronchitis. If it's hot, then it's asthma. You might want to add use some I'm not sure about the spelling. I hate pinyin. I have a 2-stone combo. 穿破石 and 石见穿. 穿 means through. 破石. 石 means stone. So the 2-stone formula. This stone formula is good for everything. I use it every day a lot. For example, for the respiratory system, for the blockage, for the liver cirrhosis, for the stomach pain, period pain, and for the endometriosis, for the neck pain, for the emotionally disturbance, and majorly is good for cough and phlegm and the asthma. So you must order all this combination from Tina. It's very, very important, and it's very effective too. Whatever. So 2-stone combo. 穿破石石见穿 2-stone. You must have that by your clinic, huh? It's good for everything here, and also for the hard to swallow. Hard to swallow, you should use my Hypo combo. We mentioned earlier, huh? Difficult breathing. Oh, now this is not a problem. Difficulty with exertion. The pulse might be a little 鼓, remember? Might be 鼓. Up and down. And that means there's short of breath, not enough oxygen. Maybe from the thyroid, from the goiter, or maybe just pure respiratory system, not necessarily this goiter. So you have to do your own differential diagnosis. And if nothing works, then you switch to something blocking here. Yeah, actually, you can see from the ear point too, if you're good with it. Let's so the hypo combo will be very effective here. You may call this hypo combo. Yes. Hypo combo and 2 stone for goiter. Huh. But I have another stuff. What I'm trying to tell you, when you encounter this kind of a problem, looks like some upper respiratory system, even it looks like an allergy, but still, if you try all your stuff without any success and try to find if there's a goiter there. Huh? But I do have something later. Hey, Sam, you want to take 5 minutes break? I know you have some commercial to do. Hello, Sam?
All right, we can take a 5 minute.
Okay.
Recording stopped.